Okay, now we're live. So, hello everyone. Thank you so much for joining us for another session with WebCeph X. And today we're joined by Dr. Jenny Jeon, an orthodontist from California. So, thank you so much for joining us, doctor. And whenever you're ready, you can take it away.
Okay, sounds good. So my name is Dr. Jenny Jeon, and I am a recent graduate from UCLA Orthodontics, and I'm currently practicing in Los Angeles, California. So today I'll be just sharing with you the life of an orthodontist, what I did to get to being an orthodontist, and if you are interested in being an orthodontist, this will be a very good session for you. Okay, so what's my story? My story is basically that I was born in Korea. My parents were also in medicine and dentistry, and their stories really affected my life as well because my mom is an orthodontist, and that being the case, they influenced me a lot in becoming an orthodontist myself. I moved to the US because my parents saw that knowing how to speak English was a major part of being successful in a global scale and in being, more of a leader in the particular field of anything that I wanted to do. And so we moved to Southern California, where my mom did a fellowship at Loma Linda University. And I knew from an early age that I wanted to become a dentist, at least, not quite yet if I wanted to be an orthodontist or not. And so I went into the 7-year BA-DDS program at NYU, and then I got into UCLA for orthodontics, and then now I'm working in Los Angeles right now. Also, my social media is for IG is Dr. Jenny Jeon, and I have a YouTube page as well where I upload some day in the life and other things as well. So how did I know I wanted to be a dentist or an orthodontist? My parents are also in this field. And when I was young, I thought that everyone kind of just grows up to be their parents. And that was a good case in my case because my mom was an orthodontist. My dad is actually a plastic surgeon. And I was interested in surgery for a while. But I think based on looking at lifestyles of surgeons versus orthodontists, I ended up choosing the orthodontist path. And so straight out of high school, I went into an accelerated dental program, which basically means that you get to cut down some years, as well as the fact that you are guaranteed to get into a dental program as long as you upkeep your GPA and your DAT score. So how does one become an orthodontist in the US? The traditional path is that you have to go through high school, you have to go through college for 4 years usually, and you can pick any major you want, although you do have to take the prerequisite classes for dental school, which is biology, chemistry, organic chemistry, physics, etc. And also dental school for 4 years, and then orthodontic residency for about 2 or 3 years. The path that I took was I went through high school, of course, and then the accelerated dental program was a combined program of the college portion and the dental school. So college was condensed down to 3 years, and then dental school was 4 years. I was an automatic biology major, and we had to upkeep at least a 3.5 GPA. Most of us were higher than this, and DAT scores were to be minimum above average, above national average. And then I applied for orthodontic residency, which is traditionally 2 to 3 years. Mine was 3 years. And so what was college like for me? High school really prepared me for college because my high school was a very competitive public high school. There were stressful moments in college and some late nights, but I did have a lot of fun exploring New York City, and I thought I was studying hard in college, but little did I know, dental school was a complete roller coaster of emotions, of studying, of exams and practicals and so many other things that college did not even compare in comparison. So just a little, very brief comparison on the course load from college to dental school. This was my second year of college, where I was taking probably one of the harder courses like organic chemistry and molecular cell biology. And so this was my fall semester and this was my spring semester. And so total there was 35 credits. And dental school second year, which is notoriously the hardest year for studying in dental school, we took 57 credits in total. I know it's just as fall, but it kind of gets condensed down into just one whole year. And so for 2015, we had 57 credits in total. So you can kind of tell the difference in course load from college to dental school. So in first year, we were studying 24/7. I studied as if I was like a chicken with its head cut off. And what you learn in one semester, one quarter and semester of college was something that we learned in 1 week's worth of time in dental school. And so you can kind of imagine how much information we were slammed with. And so these were in first year, the courses that we took were courses in normal biology and basic sciences. So in first year, you get to learn everything that's normal, so that later in second year, you can learn everything that's abnormal, which is basically the reason that we are dentists or doctors, that we treat things that are not normal. So the courses included anatomy, craniofacial biology, neuroscience, which doesn't seem to be something that's related to dentistry, but neuroscience definitely is actually one of the core classes that we take. Basically, everything that you learn in med school, we also learned in dental school as well, because we are still treating the human body and everything is interrelated. Also, on top of doing all of those courses, we had to train our hand skills. So we were drilling plastic teeth, and it may seem very simple in the beginning, which was something that I thought, I thought drilling teeth, I'm good at origami or anything, hand related, but drilling plastic teeth with very stringent criteria to the 1 millimeter, 2 millimeter error margin is very, very difficult. And so that's something that people do struggle with. In second year, we had courses in pathology. So now that we've learned everything that's normal, we're learning everything that's abnormal. And we take systemic pathology, oral maxillofacial radiology and pathology, karyology, periodontology, prosthodontics. I know all of this is like new terminology for you guys, but basically all of these courses in dentistry that you would have to know in order to practice it, and etc. And then in second year, there's more drilling on plastic teeth. In our dental school, we did crown preparations, which are something like this, where we have to reduce the structure of the tooth in order to put a crown on it, and also dentures and other prosthodontic procedures. And I have a very brief video of my day in the life, and
as I go through my
it's a constant struggle to try to find motivation to study. And I really need to study for this test. Do you see my screen, by the way? Yeah, okay.
Yes, we do.
So that one day when I look at a radiograph, maybe I can save someone's life. Who knows? Oh, it's snowing really hard. Too foggy. All right. Wish me luck. So this is our sim lab, our second year sim lab, and that's the typodont that we use to drill teeth. And in this case, we were doing a gold onlay. And that's the mannequin that we use. So this is a relatively short video, just a little sneak peek on what my life was a little bit like. Let me pause that. And then... All right, so in third year, we took advanced dental courses and we entered clinic and we got to treat real patients starting on ourselves. And so yeah, we started seeing real patients, which was very nervous. I was very nervous about that in the very beginning, as we all are. And at the end of D3, which is the third year of dental school, we started to apply for residency according to what field you wanted to pursue. And fourth year, of course, you enter senioritis. but there are imminent graduation requirements. So basically, we do have to do dental procedures that are required for us to graduate, such as dentures, crowns, scaling and root planing, root canals, etc., in order to graduate. So how do people decide on their specialties? And as I mentioned, you do want to apply for these specialties at the end of D3 if that is something that you want to enter immediately after dental school. So for me, at the end of second year, I really had to evaluate this because at the end of second year, you definitely need some kind of research experience, and you need to start thinking about the extracurricular activities that you need to build up in order to be a competitive applicant. And so I asked myself, what seems cool to me? And the three specialties that came to mind were OMFS, which is oromaxillofacial surgery, and pediatric dentistry, and orthodontics. And narrowing it down from these three, I observed faculty in each specialty. I looked at their lifestyle, I looked at their personality, and I also looked at their appearances to see what I wanted to be like when I was at their position. And when I looked at all of these criteria, I saw that orthodontists were probably the most well put together, the most glamorous, and the most youthful out of the three in terms of women orthodontists and women pediatric dentists and women surgeons. And so that really influenced me on picking this specialty, as well as my mom's influence, as well as my dad's influence. So what exactly is orthodontics? Orthodontics colloquially is fixing teeth and jaw positions, but formally it is the diagnosis, treatment planning, treatment of malpositioned teeth, jaws, and occlusion. And occlusion basically just means the bite, your teeth and how they bite. So these are some of the problems that we treat. Here we see a tooth that is misplaced out of the bite, and so the gum is kind of receding. This is called an anterior crossbite. This is called the posterior crossbite, where the posterior, the back teeth, the molars and premolars, as well as actually some of the front teeth, are in crossbite, meaning they are overlapping in the opposite way. And there's crowding here where the teeth are crooked. This is an open bite where the front teeth do not touch together. So for example, this patient, they cannot bite into like a pizza or taco or anything like that. This is protrusion where the front teeth are sticking out. We can definitely pull these teeth back, sometimes with extraction of teeth and expansion or functional appliances. This is ectopic eruption, where this molar is supposed to actually come out in this area here, but it is actually coming out in front and resorbing this primary tooth here. And this is an underbite called a class 3 malocclusion. And this is a diastema where there's a gap between the front teeth, and then any oral habits that may manifest into teeth problems, such as finger sucking, which can lead to things like open bites like this. Here there are some just basic malocclusions. So here is a class 1, which is basically the normal bite. And here you can kind of depict it in puzzle pieces, where the puzzle pieces are fitting well together. However, there's also class 2 malocclusion, where the lower jaw is a little bit farther back than the upper jaw. And so when you look at the face, the lower jaw and the chin is a lot more protruded than normal. And this is a class 3 malocclusion, where the lower jaw is ahead of the upper jaw. And this is the classic underbite that you see in some people. Probably one of the more famous celebrities that have a class 3 malocclusion are Keira Knightley. She actually has a class 3 malocclusion. So here's just a case presentation on one of my patients that I treated in residency. So this patient presented with molars that were just bombed out. They were treated, and it was stably treated, where there's no active cavity left. But in order to save these teeth for his entire lifespan, he was about 12 at the time that we started. It would not be a stable result at the end. So what we decided to do, here you can also see that the front teeth are a little bit protrusive, meaning they're a little bit too far forward, and they're proclined, meaning they're angled a little bit too flat this way. And so that really affects the lip position because when the lip is actually supported by the teeth. And so depending on where your teeth are, your lips also can change. Oh, and so in this photo, you can see that the patient can't really close the lips together because the teeth are so far ahead apart. So here you can see the 4 molars, 1, 2, 3, 4, and these have 3 of them have undergone root canal procedures, and 1 is so close to getting there as well. On the lower, you can see some teeth that don't have enough room to grow into, and so we call these impacted teeth. And this is a perfectly healthy tooth that could come in, but it's just being blocked by the fact that these teeth are caved in. And so here is just another radiograph of what happened previously. And so here you can see that even before the root was developed before, there was still no space on the lower. So this happens a lot in patients who lose their baby teeth early on because of cavities and things like that. And so here you can see we put on braces, we leveled his teeth, and we're starting to close some of the space. And here we're actually bringing the second molars forward so that we can substitute these as the first molars. So as a comparison, you can see from here where we extracted these teeth, and then we brought the second molar forward. And so here you can see that the impacted premolar has emerged now. So we definitely saved that tooth instead of having it impacted and later perhaps not salvageable. And so here you can kind of see the difference in the tooth positions. Here you were seeing that the teeth were very proclined, angulated like this and more forward than normal. And here you can see that we have taken the teeth back more so that he doesn't have as much of an angulation in the teeth. And you can here see that the tooth that was previously impacted down here, these 2 premolars, now actually have erupted because we've taken out the cavitated teeth and then made room and brought the second molars forward. And on the upper, we've also taken out these compromised teeth and brought the second molars forward as well. So his third molars now can act as second molars and they may erupt in the right positions. So here we've closed up pretty much a lot of the spacing. There's just a little bit of a bite problem here still, and so we've prescribed him some class 2 elastics, just rubber bands to wear in order to pull the bite into place. And so here you can see the final occlusion. He does have a little bit of gingival swelling, so gum swelling because of just poor oral hygiene, but other than that, his bite looks a lot better than it was before. And now it looks as if he's never had those cavitated teeth in the first place. And so here you can also see a comparison of before and after in terms of the face. You can see in the very beginning, he started out with this very full lip and very retrusive chin. His chin looks even smaller because of the fact that his lips are so protruded. But in this photo, you can see that we've taken the teeth back into a very harmonious area. And so he can now actually close his lips without really straining the lower chin. And so this is actually a quite common effect that we can have with orthodontics. And so it's almost like plastic surgery that we do with braces as well, braces and clear aligners. So I went into orthodontic residency after dental school, and here's a video on that. This was taken during COVID.
Hey guys,
so
my name is Jeon, and I'm a third-year orthodontic resident at UCLA. I've been getting a lot of questions as to what a day in the life looks like for an orthodontic resident, so here is a day. It's golden hour. I am walking in for my orthodontic seminar. Dear Sunny.
Hey, you're looking into the bright lights? Is that what's happening there? There you go. Okay.
Today we have a lecture by Dr. Ozaki, who is an oral surgeon and a plastic surgeon. He is our craniofacial plastic surgeon that we work with to treat our patients.
Basically what I do, frontal craniotomy, and then I move the whole frontal bar.
Orthodontists are essential in treating patients with craniofacial anomalies. Our main job is to expand the upper jawbone and align the teeth for the patient's jaw surgery. Just finished the lecture. Look at that golden hour light. I'll typically have a super duper Korean breakfast. Clinic usually starts at 9 a.m., but due to COVID, we only have half-day clinics. We have case reports due soon, which are presentations of our patient treatment progress. Oh my god. I have a research meeting today at 5:30. I need to get some things done because I tend to do two things at once. I'm using like a whiteboard to write down all my tasks. I write down the things that I need to do and tackle them one by one. There's a lot of stuff to do, but I will get it done. Are going to school. I bike to school. Here are all the residents and the faculty. We are here with the great Diana Velicu. And we're going to put some PPE on. Here is Joseph, our first year chief resident. We're doing legal research.
Lower left one.
Nope.
Not you. Oh my god. It is currently 7:05 and we are working on our x-ray tracings for our case reports. So we can see all the tooth movements that have happened between. So we're gonna look at this condyle, probably higher.
Stop filming me.
It is now 11:15. We are still here. That's okay. This was our lives in first year. Literally every day, 11 or 12, we'd be working on our. Oh my god. Look, oh my god.
I'm so wet.
And we're going home. Going home. Wow, I've gotten so much better at biking. I can actually film myself. You know, bird is actually pretty hard the first time. Yeah, and then you have to go to the hospital, remember? Yeah. Look at me now. Wait, what? Look at me now. Look at you now. Look at me. Look at you now. Look at me. Hi to the camera.
Bye, camera.
Bye. It's kind of nice to be out here when no one is out here. All right, I am back home now. Back at midnight. I am going to take a shower. Wow. Tomorrow I have more work to do. My desk is kind of a mess with all of these models that I need to work on. This is all a learning experience, soaking in everything that I need to during residency so that when I go out to practice, I will be able to do all of the things that I learned. It's at least kind of an incentive. Anyway, I am gonna go and we'll see you guys later. All right. So going back, basically my days were like that, but we wouldn't always stay in clinic until 12. Sometimes we would just get out at 8 or 7 or 6, sometimes even like 5:30. So how many patients do orthodontic residents see? So in a full day, it's about 4 to 10 patients, and you don't have any assistants. You're doing everything yourself. So that includes any wire changes, retainer checks, changing wires, repairing brackets, putting on braces or taking off braces. And you're doing all of this under the license of your attending faculty. So your faculty are orthodontists who have, 5 or plus years of experience. And in terms of their skill sets, you get to treat patients under them. And so you get to see what their philosophy is like, how they treat patients, and you kind of get to learn from that. And versus how many patients do orthodontists see per day? It averages anywhere from 30 to 150 patients a day. And on average, it's about 60 patients. In my practice, in the practice that I work at in Los Angeles right now, I see about 80 to 90 patients. I would say sometimes even like 100 or 110. And like about 15 consults a day. So it's a very fast-paced environment. And I think orthodontics is also very suited for people who kind of can do multitasking activities, because you have to do a little bit of work and then go to a different task and do a little bit of work, come back to it, and then do a little bit of work. So you also do have the help of assistants. So in my case, I do have multiple chairs like this. So I manage about 12 chairs, and I have an assistant at every chair. And so I just go to each of the chair and then tell them what I need, what I'm seeing, what I need, what needs to get done, what kind of wires I want to put in, what kind of elastics I want them to put in. I want them to have the patients do, and things like that. And so the assistants will do everything, and then I move on to the next patient. So I spend about 30 to 1 minute per patient. Unless it's like a full bonding, then I may take maybe about 3 minutes for that patient. But the assistant is working on that patient for 30 to an hour, 30 minutes to an hour. What do orthodontists do? So I'm sure you guys all know braces, and also the emerging clear aligners. And Invisalign is one of the top companies that do this. and also appliances such as this expander here. This particular expander was innovated by one of our attendings at UCLA, Dr. Moon, and this basically just expands the palate, the maxillary bone, so that you can resolve any cross bites or any narrow maxilla issues. Also, we do surgical orthodontics, and this is when there are severe jaw discrepancies. So here you can see that the patient has a very retrusive chin and the lower jaw is very small. And so in those cases, we can set up the teeth and we can refer them to the oral maxillofacial surgeon, and then the jaw surgery will be done, and we just take care of the dental portion of that. So here's just a sample of what jaw surgery can do. So same thing here, very retrusive chin, and they probably most likely did a genioplasty, which is a chin advancement as well as a mandibular advancement. So also for severe underbite cases, something like this, the teeth are very angulated in a non-normal position. And so what we do as orthodontists, we set up the teeth in the right positions in the respective jaws, and then have the surgeons move the jaws to the correct place like this, so that we can achieve a harmonious face and bite. And what are some innovations in orthodontics? Mini implants is something that was actually innovated from Korea, and it's really changed the orthodontics field as to what we can do. And so you can see it here. It's a very small pin, essentially, and it's drilled or tapped into the bone, and it's used as an anchor to pull teeth into the place that we want it to. So here you can see a very big overjet where the upper and lower teeth are very far apart from each other. And we're using this anchor to bring these teeth back so that these upper and lower teeth can be in a harmonious position. Clear aligners are also another emerging innovation in orthodontics. And here you can see the 3D digital scanning that we use in order to send to Invisalign or other clear aligner companies so that we can fabricate those clear aligners. We also have 3D x-rays, which are also called cone beam computer tomography, and that allows us to see teeth in 3 dimensions of space so that we can exactly see where the teeth are. And in this case, you're seeing a cleft lip and palate patient where the palate is actually clefted here. And so you're seeing that huge void here as well as some missing teeth. And you can more accurately see how big the defect is and where exactly the teeth are growing. And also, I'm sure you've seen some DIY clear aligner companies as well out there. And so they're a little more direct to consumer companies where they advertise directly to the consumer. The pros of these kinds of companies is that it does reduce the cost of orthodontics and it increases the access. But the thing is, for the cons, it does bypass proper diagnosis and the doctor as well. And so there may be a lot of undiagnosed problems such as cavities or bone loss or skeletal discrepancies like jaw discrepancies. And so in the end, the bite can become even more misaligned than before, and the teeth support in the gums and the bone can be compromised. And so I actually do see a lot of these patients who actually come to see me to undo the things that these kinds of at-home aligners have done. And so this unfortunately increases the cost to fix these problems by going to an orthodontist and to other specialists. There have been some lawsuits about that as well, so I would be a little bit more wary of doing those aligner companies. And so more on how I got into orthodontics. I went through high school, I took AP classes and extracurriculars, and that really helped me in college because it allowed me to skip out on some of the more basic science courses and do a little bit more of the advanced ones. And so in the accelerated dental program at NYU, I just had to upkeep my GPA. And then I did have to get a DAT above the national average, which is like not too hard. I didn't have to be as stressed about getting the highest grade possible on the DAT, which was actually a very good good opportunity for me, because if you don't need to, then I was already getting into NYU's dental program anyway. I did pursue some extracurricular activities just in case. So that included research, club leadership, outreach, and shadowing. And for dental school, I had to maintain the highest grades possible because orthodontics is one of the most competitive specialties. And so in order for you to be a competitive applicant, grades is actually the first gateway that they filter you. And so I was very stressed out in dental school, but for good reason. I also pursued leadership in clubs and class council, as well as community outreach. And I did these extracurriculars in the things that I was interested in. I think up until college, I did things for the sake of my resume, but starting in dental school, I think I started to do things that really, really interested me. And that is something that I do want to advise you guys on. And that is also in a later slide. I also pursued some research. In total, I was involved in about 3 research projects, and I think actually 3 or 4 actually. And so that is also something that is very important in getting into orthodontics. Research is the way that knowledge is further pushed, and so that is something that a lot of programs look favorably upon, and research is also very hard to do. And so if someone says they've pursued research, you can really tell that they have some tenacity. And scholarships, I'll touch on that later. I applied to some scholarships and won them, and there are ways that you can do this. I'll touch on that later as well. And externships are just visits to the residency programs that you are interested in. So I did some externships to UCLA. I did 2 to UCLA because I really wanted to get into this program for just a lot of reasons. And I also did externships at my own school, NYU, at UPenn and Harvard and Montefiore Hospital and UOP as well. So what advice do I have for pre-dental students? I would say that friends and your community is really, really important. You are the average of your 5 closest friends. And friends are not your competition. Your competition is people in other colleges and other institutions where you don't really know your competition. Your friends actually should be your collaborators and people that you share information with. Because to do all of this by yourself is not easy. And also you will miss out on some important information and important resources if you don't collaborate with people who are pursuing this path as well. Also, upperclassmen are very, very important in terms of getting good resources. And if you have really good mentors that have done really well in various courses, you can get their resources on what the exam questions were like, or which classes to take for the best GPA, and things like that. And so those are some things that I would really highly advise you to seek out. And I remember one person asked me, how can you find upperclassmen that did well, that are very high achieving, especially in these times of COVID? And I advise them to reach out to their professors, to have them help you on who got really good grades, who was stellar previously, so that you can seek out the best and get the advice from the best mentors. Also, when you're in your courses, if you're still doing Zoom classes, have your Zoom camera on, because whenever you're presenting, the presenter really appreciates participation and the fact that someone is actually listening to them. And so have the Zoom camera on, look like you're paying attention, and smile from time to time, and your professors will really appreciate that. And your professors are the ones that will be writing your recommendation letters. And so if you if you have a personal contact with them, if they know you from seeing your face, day in and day out, then of course they're going to look favorably on that much more than other people who have not been engaging. Also, do things that you're interested in. I was just talking about this in the earlier slide, but when you do things that are not interesting to you just for the sake of the resume, it really reflects on you during the interview. And in the dental school interview or even your residency interview, they will ask you about things on your resume. And if you don't have that spark, if you don't have that passion that ignites when someone is talking about something that you did, it's very boring and it's not very memorable. And the point of these dental school or residency interviews is that you want to win them over. You want to be memorable. You want them to like you. And so in order for those things to happen, you have to do things that you like, that and show them that you're passionate about things and that you can do things. And these are some recommended reading that I have for you guys. This is a book that I read in order to memorize everything in dental school. And literally, this book alone has made my dental school so worth it in terms of hacking my brain. These are just all books on how to do things better. And when you're doing things, always think about the next level, as in, how can you do the thing that you're doing even better? So think about how you're thinking about that thing. It's called the meta thinking. And so this was another book on how I did better in college and how I actually really made good use of my time in dental school as well. These two books are basically by the same author, and they're just excellent reading. And don't burn out during college or dental school, actually. The real studying and the real content that you really need to know for the rest of your life as a dentist or an orthodontist is in dental school and residency. So college is just a stepping stone. So what did my pre-dental CV look like? And the things that I would have done differently. I will show you guys my pre-dental CV right now. All right. So this was my pre-dental CV. So just my phone, email, and then my college, high school, leadership activities. I do regret not putting in all of my leadership activities. I was also a worship leader at one of the Christian clubs at NYU. And I didn't put that down just because I thought, religion shouldn't be mixed, but I really do regret that portion. And skills, any research experience and professional experience, any shadowing, definitely put this event on your resume, any community service projects and things like that. So I'm going to show you also my residency CV, like pre-residency CV, and how that looks different. So some things I regretted are that I didn't put in all of the things that I did because I thought resumes and CVs had like a length limitation. But here was my pre-residency CV. So here, objective, here is where I had my information. I just blocked that out. Education, and then college, high school. Here were my research projects during dental school. And then all of the research projects. And then clinical experience, honors, and awards, leadership, and then teaching. I did serve as peer mentor and peer tutor during dental school. And then scholarships. So scholarships, I would advise you guys to check mindsumo.com. And it's here, mindsumo. And these are just some some additional ways on earning more money in terms of scholarships. This particular company was looking for young minds to help companies come up with better solutions. And they were offering, you know, anywhere from 100 to 500 to even like $5,000 worth of scholarships. And so I just entered some of them, won some of them. And so I would really highly advise you guys to look into that. Some community outreaches, and then skills and hobbies, definitely something worth noting. Whatever you want to do, you know, whatever you do, like singing or, you know, like skiing or anything that you want to put in. A lot of interviewers who interview for dental school and residency will pick up on these things, and they also want to have fun too, right? So they'll ask you about, oh, you like camping, or oh, you like driving, you know, things like that. And so those are definitely some pointers that I would want to give you guys. And then externships and shadowing, these are just the area, the institutions that I want to go shadow. All right. So that actually concludes my presentation. I will welcome any questions at this moment.
Okay, so yes, we do have a lot of questions. I'll just start with mine. So you went into the 7-year NYU program, but did you consider any other dental schools other than NYU?
Well, the thing is, I couldn't, because I had applied straight out of high school, right? And so the bachelor's degree is only awarded after the first year of dental school. And so because I didn't have a bachelor's before I applied for dental school, I couldn't really apply to any other dental school. But honestly, I think choosing a dental school is pretty hard, because you don't really know what the dental schools are like. And dental schools can also vary. They don't really follow the college ranking. So just because the college is good doesn't mean that the dental school is good. And so I would really advise you guys to reach out to dental students or alumni of those dental schools and see how their experiences were like. But I think NYU really prepared me to be a good clinician. Yeah.
Thank you.
So what are your thoughts on the third-party clear aligners like Smile Direct Club and such?
Yeah, so I did harp on that a little before. I think in terms of fixing very small malocclusions, it's not too harmful. But that's granted that, you know, everything is normal, like there's no cavities, there's no bone loss, there's nothing. And so I think it's okay for patients who have undergone treatment before and maybe have a little bit of rotation left. But in terms of going into a full case where they've never had braces, you know, want to fix their teeth, it's a very complicated procedure. And they often have a lot of bite problems later on, such that later on they can't bite properly. And in order for them to fix it, they have to go to an orthodontist, and that incurs more treatment cost. And so I would just advise whoever is looking into that to at least seek an orthodontist first, and then just see if your problem is a big one or a small one, because sometimes things cannot be resolved with clear aligners alone.
Okay. For your residency, how was transferring from the East Coast to the West Coast? Like, did you have any hardships?
Yeah, I think the East Coast is very fast-paced, especially New York City. It's probably the most fast-paced place you can ever go to. So I think transitioning back to Southern California, where I grew up, it was a little bit of a culture shock, but definitely I think people on the West Coast are a little bit nicer. But I think the East Coast really reminds me of Korea. And when I first came to Southern California, I was a little shocked as well by how kind everyone was, but like overly kind. And so that kind of like made me a little uncomfortable. So I really liked how New York City was more, fast paced and Korea like. And back when I came back for residency, it was still another good surprise to have that transition.
Oh, okay. And the next question relates to the first question, but like, why did you not choose to do residency in New York?
In New York, I actually wanted to get out of New York because I was just so stressed out from dental school that I was a little bit done with New York. I wanted to come to UCLA actually because the clinical training at UCLA is world class, and there is a very heavy clinical and research portion. And so you kind of get the best of all the worlds at UCLA. And so my mom actually knew that because she's also an orthodontist. And so she really pushed me to get into UCLA. And my family is also here as well, my brothers. And so it just worked out in all sorts of ways. Also, UCLA is a paid program where we were paid about $60,000 to $80,000 per year. Whereas other residencies, you have to pay at least 60 to 80,000 per year, if not like 100 to 120,000 per year. And so it just made sense on so many levels to try to get into UCLA. And so that's why I chose UCLA.
So did you ever face pressure from your family to pursue dentistry?
Yes, of course. That's probably why I'm in dentistry right now. I think they've shaped me to become an orthodontist from a very young age. And yeah, so I was already inclined toward the sciences anyway. And I think they saw that in me. And I think perhaps from there, they just, guided me from there to pursue dentistry and then orthodontics.
Would you recommend other students to move to LA? And is LA saturated with dentists? So is it like hard to get a job?
So I think as a general dentist, I'm not exactly sure, but as an orthodontist, I get offers all the time. And a lot of people say, LA is very saturated, but LA also has a lot of people. And so if there's a lot of people, that means there's a lot of people to be treated. And so I was actually worried about that too, but actually there were a lot of job offers and a lot of opportunities that came my way. And so I think there's still a very big opportunity out here. It's just kind of your mindset and how you look at it.
So would you say that you're satisfied working in LA?
Yeah, I love working in LA, and I think working in LA is great because you are also surrounded by other very excellent clinicians. Whereas if you were to go to a rural area, you would be one of the only specialists around that area. And so you don't have to be the best in that area to do really well. In LA, you have to be the best to do well. And so I think that kind of competition and that kind of a challenge is something that I do want to have.
Thank you.
So if you could change one thing you did in your pre-dental years, what would it be?
Pre-dental, so in college?
In college.
Okay, yeah, I would seek out good mentors. I don't think I had a good mentor, as in like someone who was 1 year above me, to ask them, oh, what did you do for this? What did you do for that? And I think having that kind of a mentor will really help you excel in all of the courses and prerequisites and extracurriculars and interviews and any application process questions that you might have.
If you chose other specialties, like you mentioned pediatrics, would you still have chosen UCLA residency, or would you have picked other place?
Pediatric residency, I mean, I'm not too sure on what pediatric residencies are like, but I do know that UCLA's pediatric residency is very good. They do a lot of sedation and they do a lot of like like hospital dentistry as well. And so in those aspects, I think UCLA is still a very good program for pediatrics. And yeah, yeah.
Thank you.
I think this will be the last question, but if you were to compare dental school and your residency years, what was more, I guess, like pressuring and challenging, your opinion?
Yeah, I think dental school was 100 times more challenging and stressful because you're still trying to get somewhere. You still have to do well in order for you to be a good competitive applicant to get into another program, right? So you have that constant stress of, oh, am I doing well? How can I do better? How can I get an A on this? And if I did poorly on something, like how can I do better next time so that like my grades are still okay? So I think that kind of pressure really made my dental school experience very stressful. If you ask some of my other dental school friends, they're like, oh, dental school was great, you know? And for me, like dental school was a nightmare because I was constantly like studying all the time and, you know, doing all of these extracurricular activities and research and things like that. And so I think a lot of your time in dental school will be a little bit miserable if you're trying to get into a competitive program like orthodontics or, you know, surgery or other specialties, but it's really, really worth it. Yeah, just it's a much different experience, much different job to be a general dentist versus another specialty, especially orthodontics. And so if anyone wants to go into orthodontics, I would highly, highly advise you guys to pursue it, and all of your suffering will be well worth it.
Okay, thank you so much. So those were, I think, all the questions.
Awesome.
And thank you, Dr. Jenny Jun, for joining us, and everyone who have attended our WebCeph X live stream. And we will end here. And please please fill out our quiz to earn your virtual shadowing hours. Thank you.